Tell me a bit about your work background.
I know I can do this job. I just need someone to give me a chance.
I want to live on my own someday.
Before my accident, I built things, but I still want to build a life.
I want to be part of my community.
I know they need help. I just don't know where to start.
Every day, people with disabilities are working, learning, and living in their communities. But sometimes they need the right supports to make that possible. And often, the most important step is making the connection.
My name is Sam. I have autism. Sometimes I don't make eye contact when I talk. That helps me focus. I like routines and computers. I wanted a job, but I didn't know where to start.
My name is Maya. I have cerebral palsy and use a communication tablet. I need some support with daily activities, but I want to live in my own apartment someday.
I was a construction worker when I had my accident. Now I have a spinal cord injury. My life changed overnight, but I still wanted independence, and I still wanted to contribute to my community.
Jordan experienced a traumatic brain injury. She communicates using an assistive device and receives aid from a caregiver.
I want to live in the community.
I work with people like Sam, Maya, Chris, and Jordan every day. Sometimes we know someone needs more support, but we're not sure how to connect them to the right services.
Our agency helps people with intellectual disabilities, related disabilities, autism, traumatic brain injuries, spinal cord injuries, and similar disabilities related to brain or spinal injuries. Our goal is simple: to help people live meaningful lives in their communities.
The system is built on 3 ideas. 1. Person-centered practices. Services should be based on what the person wants. 2. Employment first. People with disabilities should have the opportunity to work in their communities. 3. Technology first. Assistive technology can help people live more independently.
I think Sam could benefit from these services. Let's start the referral.
The first step is a screening call. The information you'll need for the call is the individual's full name, date of birth, social security number, Medicaid number if available, address, phone number, and their email address. After the call, the person is connected with a contracted intake provider or the OIDD Autism Eligibility Division. They gather medical, educational, or psychological records. For the head and spinal cord injury eligibility, a medical diagnosis is required.
Now that you're eligible, you can choose a case management provider. My job is to help you identify your goals and coordinate supports.
I want to live more independently.
That's an amazing goal. Let's build a plan together.
Services are delivered through provider agencies contracted with the state. Examples include county DSN boards, the ARC of South Carolina, Bright Start, and the Babcock Center. These organizations provide services in the community. OIDD itself does not provide direct services. Many services are delivered through home and community-based services waivers. These waivers allow people to receive support in the community instead of institutions. OIDD operates 3 waivers on behalf of the South Carolina Department of Health and Human Services: the Community Supports Waiver, the Intellectual Disability/Related Disability Waiver, and the Head and Spinal Cord Injury Waiver. These services go beyond what Medicaid state plan services cover. Currently, each waiver has a waiting list. To receive waiver services, a person must have Medicaid, meet level of care annually, and receive 2 waiver services monthly. Waiver services help people live safely and independently in their communities. These supports look different for every person.
My spinal cord injury means I need help with some daily tasks. An attendant helps me get ready in the morning.
Sometimes caregivers also provide respite care, personal care services, and nursing services. These supports help people stay in their homes and maintain independence.
I like working with data. Employment services help me prepare for a job and practice workplace skills.
Some people receive individual employment supports and group employment services. The goal is competitive employment in the community whenever possible.
Day services help people build skills and stay connected to their communities.
Examples of day services include adult day health care, support center services, day activity programs, community services, and career preparation. Waiver services also include many other supports that help people maintain independence and health. These may include assistive technology, audiology services, independent living skills training, and personal emergency response systems. Health and safety supports may include pest control services, incontinence supplies, adult dental services, and vision services. Environmental supports may include environmental modifications to the home and private vehicle modifications. These services help remove barriers so people can live safely in their homes and communities. Sometimes a person's circumstances change. There may be times when someone's health or safety is at risk. In those situations, additional supports may be needed.
Some individuals may be determined to need OIDD-sponsored residential habilitation services. This is for people who are eligible for OIDD services and experiencing circumstances that jeopardize their health and safety. Residential habilitation provides care, supervision, and skills training in a non-institutional setting.
Residential habilitation focuses on building skills and independence. Training may include independent living skills, communication skills, self-direction and healthcare management, activities of daily living and personal care skills, community inclusion, educational supports, social and leisure development. Residential habilitation is a service funded by home and community-based service waivers. It does not include the cost of room and board. The goal is always to support people in the least restrictive environment possible. OIDD does not operate emergency residential placements and is not a custodial agency. If a person is determined to be experiencing circumstances that jeopardize their health and safety, they may be added to the residential needs list. The contracted case manager then sends referrals to potential provider agencies to identify a provider willing to support the individual. Finding the right residential placement can take time. Providers must determine whether they can meet the individual's needs while ensuring the environment is safe and supportive. This process requires collaboration between the case manager, service providers, families, and community partners.
Sometimes the hardest part is finding the right door.
But when agencies work together,
People get the support they need.
Lives change.
Every referral, every collaboration, every shared piece of information helps someone find the right connection. And when systems work together, people with disabilities can live the lives they choose. If you are working with someone who may benefit from services, call the Eligibility Screening Line at 1-800-289-7012.